Welcome everyone, welcome to my channel Medical Lectures and Mnemonics. Today I am going to talk about the endometrial carcinoma and in the previous video I have already talked about the endometrial hyperplasia. So before discussing the endometrial carcinoma I am going to talk about anatomy of the uterus. So here are three layers of the uterus. One is the inner layer, which is the endometrium. Here you can see this black layer is called endometrium, and this green layer, which is made of muscles and small fibrous tissue, this is called a myometrium. And there is another layer which is present over the uterus, which is called a perimetrium. So the malignant proliferation that arise in the glands of the endometrium is called endometrial carcinoma. So here I have drawn a section of the endometrium, which is lined by ciliated columnar epithelium. And here you can see these are the columnar epithelium, and this columnar epithelium have a hair-like structure. Here you can see these red hair-like structure are called cilia. And I have also drawn here a gland of the endometrium, which is lined by ciliated columnar epithelium, and these glands secrete the estrogen-rich fluid for the embryo. So when there is malignant proliferation in the glands of the endometrium, this malignant proliferation in the glands of endometrium is called the endometrial carcinoma. Now the types of endometrial carcinoma, there are two types of the endometrial carcinoma. One is the type 1 endometrial carcinoma, the other is type 2 endometrial carcinoma. The type 1 endometrial carcinoma is also called endometriosis because it looks like the normal endometrial glands. So it is arise due to mutation in certain gene. Here you can see the P10 gene, mutation in P10 gene, which is a tumor suppressor gene. Here you can see there is a T mean tumor suppressor, and PIK3CA gene, which is oncogene, and ARED1A gene, which is a gene that regulates the chromatin structure. So when the mutation arises in this gene, it will lead to endometrial type 1 endometrial carcinoma. And the other is estrogen excess. Estrogen stimulate the proliferation of the endometrial gland. Estrogen excess is also a cause of the endometrial carcinoma. Why estrogen is secreted excess? It is mainly due to the following reason. One is the obesity. The other is tamoxifen, which is the drug for the breast cancer. It normally block the estrogen receptor in the breast, while stimulate the estrogen receptor in the endometrium. The other is post-menopausal estrogen therapy. And the other is when a female never have been pregnant in their life, and chronic ovulation. The other is menstrual cycle. And the age of presentation of endometrial carcinoma is 55 to 65 years. And there is another condition which is called hereditary non-polyposis colorectal carcinoma. This can also cause the carcinoma of the endometrium along with the carcinoma of the colon. So the other type is the type 2 endometrial carcinoma, which is very rare, and it is divided into many subtypes, but the most important type is the serous carcinoma, in which the mutation occurs in the TP53 gene, and it can also arise due to aneuploidy, which is the abnormal number of chromosomes. So the type 2 endometrial carcinoma is not linked to estrogen excess. So it is developed in those females who have endometrial atrophy and who have low body weight, and it mainly develop in later in life, common in African descent. Now the stages of the endometrial carcinoma, there are 4 stages of the endometrial carcinoma. The one is the stage 1, in which the carcinoma is confined to the uterus. And the second is stage 2, in which the carcinoma is spread to the cervix. And the third is the stage 3, in which the carcinoma goes outside the uterus but present in the true pelvis. The fourth stage of the endometrial carcinoma is the spread of the endometrial cancer behind the pelvis, like the bladder and the intestine. So, symptoms of the endometrial postmenopausal abnormal vaginal bleeding, but there the bleeding will not be associated with pain, and the uterus enlargement, which is due to the mass that arises as a result of hyperproliferation of the endometrial gland. Now, how to diagnose the endometrial carcinoma? The diagnosis can be done by transvaginal ultrasound, which will reveal the thickness of the endometrium, and if the thickness is greater than 4 millimeter, then do a biopsy, and it will confirm the diagnosis of the endometrial carcinoma. To treat the endometrial carcinoma, main choice of the treatment of endometrial carcinoma is the surgery. Surgery is done in all type of endometrial carcinoma and all stages of endometrial carcinoma. Now, the hysterectomy, which is the removal of the uterus, and the bilateral salpingo-oophorectomy, which is the removal of the uterine tube, bilateral uterine tube along with the ovaries, and the pelvic and para-aortic low lymph node is also removed. So this was all about the endometrial carcinoma. For more videos, subscribe, like, and share.